What's going on, guys? So today we're going to go a little bit of a deep dive on injuries. Okay. So really what this is going to go through is how do we prevent, assess, and return our athletes to sport appropriately? Okay. Now, you're not going to be responsible for this directly as a soccer coach, right? But it was really essential for you to know the process and know what all is involved, right? Because if you don't know what your athletes are going through when they go through their return to sport process, how do you know that they're adequately returned to sport? You're blindly accepting that the PT or the chiropractor or the athletic trainer or the MD did a good job. You're just assuming that, right? So we want to make sure you're just aware of all the things that need to go into an optimal return to sport program. Okay. So again, we're going to go through injury prevention first, what kind of things you can have a direct effect on from an injury prevention standpoint. We'll then go into when injuries do happen, the most common injuries we see in soccer players, and some specifics on the injury itself. And then we're going to get into how to train around an injury, which is another thing that you can directly affect as a soccer coach. Okay, so injury prevention, it's absolutely a myth, right? We hear prevention happen all the time. Injury prevention does not happen. Injuries are basically inevitable in sports. Okay, let's just leave that for what it is. However, we can reduce the rate and the severity of the injury, right? So again, we're probably talking a little bit more about semantics than anything else, right? We're probably saying the same thing, but we do want to call it injury reduction versus injury prevention, because we're really not preventing injuries from happening. They're going to happen in sports, but we can reduce the severity and we can reduce the rate at which they happen. Okay. How do we do that? Through an optimized warm-up primarily, right? We have the individual and the team warm-ups that we've gone over with you in the human movement module. So stick to those, right? Stick to whatever warm-up you want to go with your athletes. Whichever program fits you best, the individual or the general program. But that kind of warm-up is going to do a amazing job of getting a reduction in injuries. Okay. The other thing that we can do to reduce it is our load management. So we already had a module on that also with the acute chronic workload. The personalized individual program, obviously, with the mobility and stability. And then obviously physical preparation, right? Are your athletes strong enough, powerful enough, agile enough, or even conditioned enough to withstand the forces and the stresses of your sport? If they're not physically prepared, they're going to get injured. Simple as that. That's why strength and conditioning is such a vital component of injury prevention, not just the mobility and stability piece or the warm-up piece. We have to be physically prepared more so than what the force going through our body, right? If the cumulative force of a full 90 minutes of soccer is a 9 out of 10 stress on your body, then you sure as hell better be prepared at a 10 out of 10 rate to withstand that force, right? If you're only prepared at a 7 out of 10, then you're going to get injured. It's only inevitable that it's going to happen. Okay. So we talked in previous modules about different types of injuries, right? We typically have contact and non-contact injuries, right? Traumatic and non-traumatic injuries. If you have a contact injury, right? Someone bumps into you, someone has a bad tackle and directly hits your shin, right? How do we reduce the number of injuries and how do we reduce the severity of injuries in a traumatic situation? Resiliency training is the number one thing. We talked about it on the previous slide, right? Physical preparation. If your body is physically prepared to withstand force because you've done a lot of lifting, done a lot of power training, done a lot of velocity-based training, a lot of conditioning, your body is physically prepared, you're more than likely going to have a less severe injury than someone who's not physically prepared. Okay. The second piece to this is confidence. What we found is going into a contact sport like soccer, most injuries that are contact happen because the person who got injured hesitated to go into the tackle. They hesitated to put their foot in. They put in halfway. They weren't physically prepared. Comes across, hits them, injury, they're out for 6 months. Whereas if they went in with strength and confidence and without hesitation, they wouldn't have been injured in that situation. Okay. So that's something that we can directly affect as soccer coaches during our training sessions, right? Training someone to go full at practice and not hesitate to tackle someone, training that hesitancy out of someone is going to go a long way with injury prevention and physical preparedness. Workload management is going to be another big one, right? So if someone's chronically fatigued and stressed, they're going to be more likely to get injured. And then full rehab of prior injuries, right? The number one factor that's been researched for predicting injury is a prior injury. So if I sprain my ankle once, I'm at a highly significant rate of re-injury, okay? And that goes for any injury in the body, hamstring strains, ACL injuries. Once you've had one of them, you're more likely to get it again. But why is that? It's usually because most athletes don't go through a full round of rehab. We touched on that in previous modules, right? Most athletes will go to a general physical therapist or a general chiropractor or athletic trainer. They'll get out of pain, but they won't go through the necessary steps of return to sports. Because they don't go through those necessary steps, they're not physically prepared to return, and they re-injure the same thing. And they're stuck in this chronic injury better, and they never get out of it, right? So again, full rehab is so important when it comes to contract injury reduction. Now, it's a completely different story for non-contact injury reduction, right? Resiliency training stays the same, right? They need to be physically prepared. But with non-contact injuries, these are the injuries that happen out of nowhere, right? These are the injuries that there wasn't an event that caused the injury. Your athlete maybe woke up one day and had knee pain that they can't shake off. That's a non-contact injury, right? These are injuries that are happening because of what we call our RMPPs, our repetitive motions and prolonged postures, the things we put our body through on a day-to-day basis that can cause pain, okay? How to combat these? Our individual movement program, okay? If we can identify the weak points in our body when it comes to lack of mobility and lack of strength and work on those things preventatively, then you're going to prevent a non-contact injury, okay? The developmental sequence, we don't really need to get into that right now in full depth, but really the developmental sequence is basically just saying, are you able to do a basic task before you can do an advanced task, right? If you jump straight into trying to do an advanced task, you're more than likely going to get injured if you haven't mastered the basics. So can we master the basics of movement first before we master the advancements in strength and conditioning, before we master these high load training sessions with a bunch of skill work at a fatigue level, okay? So let's get into specific injury types. Muscle and tendon injuries are obviously the most common injuries we're going to see in soccer, okay? We're going to grade muscle and tendon injuries as grade 1, 2, and 3 as a minor strain, a partial tear, and a full tear. A full tear typically requires surgery. Partial tear does not. Usually some physical therapy will do the trick. In grade 1, a minor strain, physical therapy will do the trick, and it'll do it in a lot quicker time frame, okay? What you're typically going to see after a strain or a tear is tightness, weakness, and bruising of that muscle or tendon, okay? The most common areas for soccer players are hamstring, groin, and calf or Achilles, right? If you do strain your groin, you're 3 times more likely to re-injure it because of the factors we talked about earlier. Okay, that's a very well-researched fact right there. Usually, these injuries happen because of overuse or overtraining, right? Doing too much too soon, not being physically prepared. They can usually be traced back to limited hip flexion or hip extension. So that's something that we look for on our examination in pre-season. We want to make sure that your athletes have adequate hip mobility. If they don't, they're at an increased risk of straining a muscle or tearing a muscle. And a lot of the time they have, when you do have a strain, there's weak eccentric control. Eccentric control is that slow lowering, right? So like for a bicep, right? You're doing a bicep curl, you curl up, that's the concentric phase. Slowly lowering that weight back down is the eccentric phase. If you strain or torn a muscle, you will lose the ability to have eccentric control. So that's where you're going to see a lot of exercises in soccer called like the Nordic hamstring curls or the Copenhagen ball squeeze, right? Those 2 eccentric exercises are going to prepare someone physically for eliminating strains. Okay? The preseason time frame is the most common time frame to have these strain injuries because you see these programs that ramp people up too quickly and cause injuries right before season happens. And if you're at an increased age, you're more than likely going to have a correlation with an increased injury rates. And again, muscle tendons are 2 to 4 weeks to fully heal, plus another 2 to 4 weeks to return to sport. So typically, if you strain a muscle, you're probably going to be out for a minimum of 4 weeks to fully return to sport without re-injuring it. All right. Bone injuries. So we're talking about fractures. So fractures are the most common, one of the most common direct trauma issues for soccer players. They can also be overuse injuries, right? So doing too much too soon. The fifth metatarsal, so the small bone on your foot that attaches to your pinky toe, that's the most commonly injured bone for soccer players. It's called a Jones fracture. I guess it was then Dr. Jones who discovered it, right? Doesn't matter about the name. The crazy thing about these is that they're asymptomatic until the actual break occurs, which means you could be dealing with something like this or predisposed to this for years before it actually breaks, okay? What we found in preseason testing is that if you have limited rotation in your hips on either side, you're at an increased risk for a metatarsal fracture, okay? If you stand with a high arch, you stand in a pronated or a supinated position, or you have like someone who walks with their toes facing out, they are all at higher risk for this type of fracture. Okay. Those same predisposing fractures can also put you at more risk for shin splints. And shin splints are actually just a inflammation of the bone before a fracture occurs. Okay. So it's just a less severe fracture of your shin. Those two things can account for most bone injuries in soccer players. Okay. So what do we do about it? If it's injured, well, we got to do 4 to 6 weeks of rehab plus 2 to 4 weeks of return to sport. So you're going to be out for about 6 to 10 weeks with a fracture. Okay. To prevent this, again, we've already gone over, right? Physical preparedness. Ligament injuries. We're not going to go too far into this one because we have a complete separate module on ACL tears and deep diving on that because we know that's an epidemic here in the US. Sprains in general are what we call ligament injuries. So grade 1 is minor, grade 2 is a partial tear, grade 3 is a full tear. So very similar to strain. Strain and sprain are basically the same thing. We're just talking about a ligament for a sprain and a muscle and tendon for a strain. Okay? Most common ligament to be injured is your ankle or your ATFL, okay, your anterior tibiofibular ligament. So your ATFL, it's the muscle that it's the ligament that attaches your outside of your ankle to your foot. Okay. So that muscle is typically okay. So the most common sprain in your body for soccer players is usually an ankle sprain. And usually it's on the outside of your ankle at a ligament called your ATFL. And usually what ends up happening with that one is that your foot turns in, kind of rolls inwards, and you get a big stress on the outside of your ankle and it causes a sprain, right? Whether it's a grade 1, 2, or 3. Once you have your ankle sprain the first time, you're 2 times more likely to sprain it again than someone who hasn't sprained their ankle in the past. Okay. Again, we know that's because of probably poor rehab. So take that for what it is. When you have an ankle sprain, usually it swells up. You can brace it to give it a little bit of stability while it heals, but you don't want to brace for more than 2 weeks. If you brace long-term at a joint, you're actually going to decrease the strength even further in that joint and make them more likely to get injured. So bracing actually makes you more likely to get injured than it does to prevent injuries. Just a heads up. How to prevent ankle sprains from happening? Landing mechanics, improving ankle mobility, and working on things like balance and cutting. We can work on those things, we significantly decrease the risk of ankle sprains. Okay? Ligaments take 8 to 10 weeks to heal. So if that's the case, you have to add another 2 to 4 weeks of return to sport. You're out for a good 2.5 months if you've significantly sprained your ankle or sprained any other ligament in your body like your ACL. Okay? Again, The next module will go over ACL in depth. Cartilage injuries. These are injuries that happen at the joint level. Okay. Cartilage is usually the lining of surfaces of the joints. So the most common places for you to have injuries here are at your hip socket and your knee joint surface. Okay. A common injury that soccer players will get is something called femoral acetabular impingement, or FAI. Basically, this is a structural abnormality, which means if you have a ball and socket joint of your hip, either the socket is too small anatomically or the head is too big. Okay. One of those things happen and they're called a cam or a pincer. That's just a deformity, the name of the deformities. But what it causes is a pinching of the lining of the joints. And that is called your cartilage, right? If you pinch that cartilage, you create what's called a labral tear. And that causes that requires a surgery for treatment. Okay. Once you get a surgery for the labrum, then you have to go through post-op rehab, which takes anywhere from 4 to 6 months. So can we screen for this? Yes. We can tell who has a higher likelihood of an FAI injury on our preseason assessment. And that's why some of our hip tests are so important to screen out who's at injury risk. All right. So nerve injuries are the next one. And the most common, obviously, is the sciatic nerve. These are these complaints of shooting pains, numbness, tingling, weakness, or maybe even if it's chronic enough, there's some muscle atrophy going on or some like shrinking of the muscle. This can happen at the back of the leg, the front of the thigh, down the outside of the shin. Those are the most common areas that you're going to have these complaints. Usually these things happen from direct trauma. A direct trauma happens, the nerve gets pinched from that trauma and then shoots these pains down the leg. Okay. They can also happen in the back. Also, you can get a pinched nerve in your back and it can cause back pain or it can cause pain down the leg. Okay. The lateral aspect of the knee, the outside of the knee, is the most common area for soccer players to feel this type of pain. Okay. They'll have pain on the outside of the knee, and they may complain of numbness and tingling or any kind of shooting pains going down towards their ankle from their knee. Other common injuries in the US that we need to pay attention to, Osgood Schlatter. This is something that happens, it's a growth plate injury that basically happens to youth athletes anywhere from 10 years old to 14, 15 years old. Basically what's happening there is a tendonitis of the patella. So there's a little notch underneath the knee. You can find your kneecap, but if you go down a little bit lower, you can find a little notch in your knee. And that space right there is where that patellar tendon is housed. And when you overload that tendon, it can cause inflammation of that area and cause what's called Osgood Schlatter. It's pretty painful. It's basically a front of the knee pain in a youth athlete is typically what that happens. Most kids do grow out of it, but it does require some short-term therapy to relieve the pain. Concussion is probably the most common injury in the US for athletes, right? Across the board. There are 3.8 million concussions in the US per year. And concussion is just a junk term for a traumatic brain injury, right? Your brain got injured. So concussion can show up as a loss of consciousness, amnesia, or other cognitive dysfunction, not being able to think or see straight, right? Someone's going to complain of dizziness, nausea. They're going to be dazed, confused, have a lack of memory, have trouble speaking, have trouble with just kind of cognitive tasks, right? They may complain of headache, sensitivity, and there may even be mood or concentration change. There may even be personality changes based on how severe the concussion is. Okay. Second impact syndrome. This is something that's life-threatening. So this is someone who's had a traumatic brain injury or a concussion, and that concussion is still healing, and they get another concussion. Okay, that's a life-threatening situation. Okay. Post-concussion syndrome is all the effects that I just named off. It's the 7 to 10 day period after a concussion where all those symptoms are full blown, right? Recovery from those symptoms can take up to 4 weeks for full recovery. So a lot of the time with concussion protocols, they're usually about 3 to 4 weeks long. And if we're really being strict about it. We definitely don't want someone who's had a concussion to return to sport for up to a month after that concussion. Okay? There can be long-term effects on balance, and there can be long-term effects on the vestibular system, right? Knowing and proprioception, knowing where you are in space. And sometimes that just takes a little bit of extra rehab to get them back to 100%. So what happens when your athlete has an injury? Should they just rest? Probably not, right? Absolute rest is usually not great. You should definitely rest an area that's inflamed or an area that's painful and injured, right? Just to give it a little bit of space, but you shouldn't completely rest most of the time. You should work out around the site of injury, okay? This is going to limit swelling and pain at the site of injury, but it's also going to improve the underlying root causes of injury, address secondary compensations because of injury, and then obviously physically prepare them to return to sport. So we need to train around these injuries. And again, I wouldn't do this yourself. I would refer to your preferred physical therapist, sports physical therapist, to go through this rehab process and train around the injury for them. Please do not try and train around injuries yourself. Okay. As an athlete, as athletes, they have teams around us, right? This is the team that we're trying to develop. Your team should consist of a orthopedic surgeon, a physical therapist, a sports performance specialist, and a skilled coach, right? So that should be our team, and you being the skilled coach. When someone gets injured, we have to have a team meeting to get on the same page about time frame for return to sport and have all parties agree on it, so that we basically make a pact to not make this person come back sooner than necessary. And we're not saying that all coaches do this, but a lot of the time in the medical field, we get a lot of pressure from coaches for returning athletes sooner than they're ready. We can't do that. It's only going to put your athletes at risk. So we need to stick to it once we agree to the time frame as a team. So that's it, man. That's injury prevention 101. Hopefully gives you a better idea of the time it takes to heal an injury and what we can do about it, right? To get people back to optimal sport performance. Our next module is really going to go over into some return to sport and rehab, individual session specific, kind of how we structure our sessions so you get a good understanding of it. Again, we're not looking for you to become a rehab expert here, but we want you to gain an understanding of what it takes to rehab an athlete, right? Hope you enjoyed this module. We'll see you in the next one.